everyone, welcome back to my channel. I'm super excited to be joined today by Bart Rzepa, who is actually a 6th-year medical student, not a 4th year like we have here, so that's my fault. And he's a 6th-year medical student at Medical University of Warsaw in Warsaw, Poland, and recently successfully matched into Diagnostic Radiology. So technically you're an IMG, so I really wanted to pick your brain and kind of get to know everything that led to your success this year. I think tons of people will find that insightful. So thank you so much for being willing to talk about your experience.
Yeah, absolutely. Thank you so much for having me on here.
Oh yeah. So just like to open it up, like tell me a little bit about you and kind of how you ended up here and radiology and all of that.
Yeah, absolutely. So my name is Bart. As Yasha said, I'm a US IMG from the Seacoast area of New Hampshire. I was born and raised there in a really small town. I'm talking really, really small, farm on one side of my house and farm on the other side. And since I was pretty young, I knew that I wanted to do medicine. But when it came time for me to apply to schools, once I graduated high school, nothing was really sitting right with me. I couldn't picture myself at any of the undergrad programs that I had applied to and toured. And so as a Polish citizen by birth, my father, he was born there, so I'm technically a dual citizen. I started to look at my international options, one of which was the Medical University of Warsaw in Poland. This is a 6-year combined MD program, so I get postgraduate coursework done in the same place. I start with anatomy and physiology in my 1st and 2nd year. And by the end of it, we're doing clinical rotations and ready to apply back to the States. Overall, I think it's a really cool way to do med school. A lot of the international space does this in the UK, much of Europe, and in Asia as well. The US does this combined program, this 4-year pre-med and a 4-year post-grad, but they're rather unique in that regard. And yeah, I ended up dual applying actually, to emergency medicine and diagnostic radiology this season. This is my 1st season applying. All in all, while these specialties may seem a little bit different, at their core, they appeal to the same kind of people, I think. So yeah, I'd love to talk more about, these specialties and what led me to choose them and how dual applying went and all this kind of stuff.
Yeah, so there's so much to dissect here. I feel like, how did you choose, EM and radiology?
Yeah, so EM was kind of my first love, my first foray into medicine, because I have a close family friend of mine who is an EM physician. He's an attending. And when I first started going to med school out in Warsaw, I would come back for the summers and I'd go with him to the hospital. We do shifts together and kind of this observership, externship style relationship. And I was like, wow, this is really fun. I like this. But for a time, it was all I knew in the field of medicine. So I thought, okay, I know about this. Maybe I'm kind of good at it. Maybe I can deal with the high-paced work. I'll go for it. Before really sitting down and exploring all of my options, that was the one that I kind of anchored onto. Radiology came later, and once I was exposed to more clinical rotations, I saw what I liked and what I didn't like in the hospital, the kind of lifestyle and the kind of work that I felt appealed to me. I'm very task-based. I'm very, I like puzzles and thinking, and sometimes I'd even like studying for STEP more than clinics. So if that tells you anything.
Yeah. That's awesome. So emergency medicine was kind of the first thing that you discovered, and then you found radiology later. I feel like that's a pretty common way, even in the US, like a lot of people find radiology later. So really not surprising at all.
Yeah.
How did you decide to actually dual apply? Like, were you like, I really like one or the other, or like what led you to that decision?
Yeah. So at the onset, I knew, okay, I'm an IMG. I have to apply very broadly. I have to send out a lot of applications because, the chances are just overall worse for an IMG. I knew that going into it, but I had to adapt. Furthermore, the emergency medicine has the SLO. I don't know if you've heard of the SLO before, the standardized letter of evaluation. And this, for those who don't know, it's a letter of recommendation that must be filled out by emergency medicine faculty at an accredited residency program. They're all filled out by other providers, but the golden standard SLO is filled out by an emergency medicine attending, who also trains residents. When it came time for me to apply to clinical rotations, this big old bad virus called COVID-19 reared its head, and all clinical rotations were shut down for a year and a half, 2 years. So my chances of getting a SLO were slim to none. And I knew that if I was going to apply to emergency medicine without a SLO, they have no way to compare me to the other applicants. And I knew that I would have a tough time.
Mm-hmm.
I kind of leveraged that with my love of radiology and my how I felt like it worked for me. And I said, okay, you know what? I'm going to try my chances. I can do this. I'm probably not going to get like a million interviews anyways because I'm an IMG. I can handle the load. Let's just do both and make my chances as good as they can be. And maybe I can let the system decide for me which one I want to do more.
Yeah. So like, how did you fare in terms of your interviews? Did you get a lot of emergency medicine interviews? Did you get a lot of radiology? How many applications did you send out, I guess? Like, what was your yield like?
So my yield was quite low. It hovered at around, I want to say 3 or 4%. So I sent out 402 applications total.
Whoa,
Yeah, it's crazy, but honestly, I wouldn't recommend an IMG do much less than that. Based on my experience. I'm speaking to a bunch of students at my school who are looking to apply, and I think that kind of rings true because the yield for an IMG, it hovers around that, like 3, 4, sometimes even 1%. It's quite tough. So I got 18 interviews in total, 8 in diagnostic radiology, 2 in emergency medicine. So my initial fears seem to have been rather well founded.
Okay.
And then 2 transitional years, 5 prelim medicine, and 1 prelim surgery.
Okay, nice. So 402 applications. Wow, that is a very good lesson for all IMGs because that's really low. I mean, just overall, that's tough. That's all I can say is it's really tough to be an IMG. I guess.
I knew what it was going to be like going into it. At the end of the day, it's a tough road, but I think every IMG, once they start walking the road, they realize what they can expect, what it's going to be like.
Yeah. So, I mean, even after that, you still matched successfully. So like, was there anything that you feel like you did specifically that kind of helped with your success?
I think honestly, all of my preparation leading up to the match itself, including, for the past 6 years that I've been in school, we're just really instrumental, working pretty much every step of the day, every step of the way, more or less every day thinking, okay, what can I do to make myself more competitive, both on paper and when I go to the interview. So I made sure to focus on my steps. I got some research out of the way. US clinical experience was huge. Getting that during the time of COVID was like ridiculous, but I managed to get a rotation, which is, absolutely so thankful for that. And then, I focused on extracurriculars as well. Once I knew that they were, that everything else was kind of solid and I wasn't going to have my, my core, the core parts of my interview impacted by it. So I got involved with student government, president of my med school currently, actually. And I achieved rather some high achievement in the music world. I'm like some orchestras here in Poland. So I think that helped me and like kind of made me seem like more well-rounded, more of like a person. I think that helped out. So I tried to play that angle, especially in the interviews. Yeah.
Gosh. Well, how did you go about finding like your rotation in the US? Because I know a lot of IMGs struggle with that, just like you were saying. So like, what did you do to find it? And, how many did you just do the one?
So I had, as far as like official clinical rotations, it was just the one. In San Diego in May of 2021, it was, I basically just reached out to not only as many residency programs as I could to see if they had spots, but also private clinics. And this place in San Diego was a private clinic, but the attending who worked there was also an attending at Kaiser, so she was able to kind of leverage that in the letter of recommendation, able to compare me to existing med students and give the letter a little bit more weight,
For sure.
Yeah, so I use VSAS, I use VSLO, but many programs don't update their side of that for IMGs. So like the same 3 programs have been on VSAS since like 2020 or something. So, but I still try them. And then, yeah, just reaching out to residency programs, sending, I don't know, a couple hundred emails saying, hey, I'm an IMG, but I live here. Can I come hang out for a little bit,
Yeah.
And then also observership opportunities. This family friend of mine who's in EM, I would go to the hospital with him pretty much every chance I could get, get that patient experience and be able to say during my interviews, yeah, I know how to use Epic. I know how to navigate my way around the US hospitals, so they don't have to necessarily worry about that.
Okay. And is that something that came up during your interviews or like pretty routinely? Like, would they actually ask you those types of questions?
For sure, for sure. They'd say, what challenges do you anticipate navigating the US system or transitioning from the European system to the American system? And therein I try to answer, oh, I'm ready, I'm confident. You won't have to teach me anything. No Epic training modules for me.
Oh my God. Those are painful. No, that's
Yeah.
really interesting. Yeah, because I never really thought about any specific questions that an IMG would get that, the rest of us maybe wouldn't get, but that's really good to know and good for IMGs to prepare for so they have a good answer for that.
Yeah, for sure. I would definitely be ready for that question. Be ready to convince your PDs that you will, integrate super seamlessly and there will be no problems in your transition, all this kind of stuff. I mean, reality may be a little bit more bumpy than that, but I think everyone has a tough time at the beginning of their intern year anyways.
Yeah. I mean, no matter where you did your like training, even like in the US, every hospital has a different system. It's never, even if it's Epic, it's like slightly different, just enough to like make it confusing. So
yeah. And you'll have to learn a new one when you go to the VA anyways, if you have rotations there.
Depending where you are, you're definitely going to have to learn more than one. So that's really good to know. Did you tell your letter writers that you were dual applying, or did you get separate letters altogether? I know that for EM you had to get the SLOE, but aside from that, like what did you tell your letter writers?
So, one of the things that is one of the things that's very integral for IMGs is to get letters from US faculty. There are varying opinions on this, but the general consensus is a letter from a non-US faculty doesn't hold any weight. They might as well not be there. So with that in mind, I was not able to accumulate a huge number of letter writers because I, only did the one rotation and had observerships and stuff. So I didn't have all these nice relationships. So I used the same letter writers for my prelims, for my transitional years, for my prelim surge, for emergency medicine, and for radiology as well.
Okay.
I just asked them specifically in the letters, hey, please remember to change radiology to prelim medicine in here, and then trusted that they did.
Okay, so you use the same letters, but you did have them write like technically a separate letter for.
Yeah, I had to send like separate requests through ERAS to them. Like they'd get like 5 different requests or however many.
Oh my gosh. Good to know. Okay. And did your letter writers seem like open to this, or was it a little bit awkward? Like how willing were they to do that for you?
Yeah, they were super open. One of them was an IMG who was attending here in the States, and so she knew what it was going to be like. Like she knew what to expect, and I'm sure she had to ask her letter writers to do the same thing. And they were very understanding. They're like, yeah, because they're willing to. I mean, they're doctors too. They went through the match. They know what it's like.
Yeah. No, I know. I think everyone is willing to help you in whatever way that you want, but sometimes I feel like internally you feel like uncomfortable maybe asking, but
yeah, it's like, I know that we did this rotation together in family medicine, but could you recommend me for radiology instead?
Pretty much, yeah. And they're like, what? Why radiology? You're so good with people.
Yeah, exactly. Exactly.
So before we get to like ranking, I just want to ask you one question about the ECFMG, only because I get so many messages about like very specific things regarding the ECFMG. Like, did you have any issues with them certifying your application? Like, was there anything that made that easier, that entire process?
So I'm actually not ECFMG certified yet. Okay. This has been a point of contention the entire application season, and a source of huge anxiety for me actually. Because many programs on their website or otherwise say, we require ECFMG certification to rank you, or we require ECFMG certification to match, right? I think that this is a little bit misguided, or many, what they really mean, what the real requirement is they require ECFMG, or eligibility for ECFMG certification,
Okay.
or they've completed the requirements for ECFMG certification, meaning, steps and medical school. And as of last year, completion of the OET, which is a standardized English exam. That needs to be completed as well. But I've had no problems with ECFMG. I'll be submitting my diploma to them as soon as I graduate, and it'll be this April. So if I have any problems, I'll let you know. But I'm anticipating it to be like rather smooth.
Okay, so that's really good, because I get so many messages about like the ECFMG certification process, and like, as someone who has never gone through it, I really have like no way of guiding anyone, because I'm like, I don't even know like what it really entails. So it's kind of good to know that it's sort of just keep going until someone stops you, essentially.
Exactly. I was very I was very fearful that, I'm not going to graduate in time. I'm not going to graduate before match, so I'm not going to match, or I'm going to have to withdraw, but no,
Right.
you just have to do all the stuff that all the testing requirements, then you'll be fine.
Yeah. So when it came to make your rank list, I know that you only had a couple of emergency medicine interviews, but did you decide to rank all of radiology together and then EM and then prelim, or like how did you kind of go about making your rank list?
Yeah, sure. So all of my radiology was at the top as one big block. I didn't, I ranked them based on, my preference, location, training quality, all this usual stuff. And then directly below that, I put my transitional years because of this whole initial residency period funding issue, right? And then prelim surge. And then I put all of my prelim medicines. And then at the very bottom, I initially had EM. And then the night before the rank lists were due, I called up my mentor, my emergency medicine mentor, and I'm like, I'm not sure, I don't know if I really want to do this field. I don't know what's going on. I don't know what the future of it's going to be like. And do I even want to do this anymore? And internally, let's just say, I've been in the radiology Discord and hanging out with them for months, but I haven't touched the one for emergency medicine,
Okay.
I kind of know it. I kind of at some point felt internally like, okay, actually radiology is what I really want to do. And I dropped EM altogether, took it off my rank list.
Wow. Okay. Interesting. So that's like major. That's a major decision that you made. So totally got rid of it. I mean, you wouldn't have matched there anyway, seeing as you matched radiology. So it wouldn't have mattered.
Yeah, true.
But
That's
you
very
never
true.
know.
That's very true.
Yeah. But you never know. Like, I mean, that's still a big decision to make before you have any idea what's going to happen. So
yeah, it took a lot it definitely took a lot of gusto to intentionally shorten my rank order list,
Yeah, no, totally.
Yeah, especially given the whole IMG situation. But I'm happy with the decision at the end of the day. And kind of funny, I have an emergency medicine rotation required on my transitional year that I'm coming up on, so maybe we'll see.
Oh my gosh, yeah. I had to do emergency medicine during my TY, and I was like, get me out of here. I just want to do radiology.
Yeah. Looking forward to those electives. I really am.
Yes. Well, I think I hit on most of the things that I wanted to talk about. Is there anything that you wanted to add about being an IMG? Like, is there anything that you really felt like was the one thing, or like the thing that really helped you the most that you would want to pass on to anyone else that's applying next year, or even just about dual applying?
Yeah, I mean, as an IMG, just know that, it may seem like an uphill battle, and it may seem like, the cards are kind of stacked against you, and in many ways they are, but that's all right. And many people make it through. Statistically, all you have to do is beat half, be in the top half, right? Because about 50% will match. And that's not too daunting of a task. I think that if you stay dedicated and you work super hard and you're always thinking how you can improve your application or yourself, identifying your weak points and getting mentors and making connections, all the things that people say, that have almost become trite at this point are actually, really important for your application. And just making sure that during interviews, you can stay like relaxed and you have a good setup. I think that helped me a lot, because all these issues with cameras, even if program directors try not to, let it impact their choices, maybe a little subconsciously, if they're looking at you in 144p, they're not going to be able to connect with this, mosaic robot person as opposed to like a crisp thing. You know what I mean?
Yeah, totally.
Yeah, I think those little things matter more than people may realize. But yeah, overall, I think it's very possible. And, people who statistically, you just have to beat half if you're an IMG, and you can keep on applying, maybe, be realistic with your expectations as well. Know that it's better to be pleasantly surprised, right, than to be disappointed, I think. So as an IMG, just know that it's going to be a little bit more tough. Don't beat yourself up if things don't go the way that you want. I was really sad and really disappointed and really anxious when I, was turned down for several away rotations. But that's just, that you're going to encounter hurdles along the way. That's just the way it goes. It's a lot of USMDs have their quote unquote culling, at the entrance to med school. The US IMGs have the same thing, but at the entrance to residency.
Right.
So just be aware of that.
Totally. Actually, there was one more question that I wanted to ask you, if you don't mind.
Yeah.
In terms of like your steps, I know it can be hard as a US IMG, as like an IMG taking the steps because you're like, oh, I haven't gone through the system or whatever. In terms of like how you prepared for that, and did you feel like you were competitive with your scores? Like, how did that experience go for you?
Yeah, so I think that I've heard a lot of varying opinions on how IMGs and steps shape up. Some people say, oh, IMGs can score better because they have more, they can take more time off to study, or IMGs score worse because their schools don't prepare them for the tests.
Right.
And I think that, the Venn, I think this goes for some US med schools as well, but the Venn diagram of my school's curriculum and the material required on STEP, the intersection was quite small. So I had to start fresh, more or less, in my third year, what would be equivalent of like, second semester, second year of a US med school. And just, start fresh, do a bunch of Anki, UWorld, first aid, pathoma, all the classic resources. I had a great study buddy. We worked together. Didn't stop me from getting 13% on my first UWorld assessment. That was great.
Well, yeah, that first one's always kind of like, okay, then here we go.
Like, okay, got a lot of work ahead of me, But yeah, overall, both of the steps went well. I got a 243 in 2019 on step 1, and then a 250 on step 2. Just before I applied. Fairly competitive scores, not, crazy, especially for radiology. I think they're about average. But, they're average for a reason. And right.
Yeah, those are really good, because a lot of people say that like to match successfully as an IMG, you have to like score extra high. You can't just do average. So it's kind of reassuring to know that like just do the best that you can, and just, I mean, you did really well. So I'm not going to say that you just did like, okay, you did perfectly, like as well as you needed to do. So
yeah, things worked out at the end of the day, right?
Totally. Okay. Those are all of my questions. Anything else you wanted to add?
I think that just about does it for me. Yeah, there's nothing that I can really think of off the top of my head. I would say that any IMGs or even US Med students who are looking for, any advice or guidance or want to call me or anything like that, I'd say, please do. You can DM me on Instagram. That's probably the best way. I can put my my handle in the description of the video if you don't mind. I can do that. That's probably the best way to reach me. And yeah, please feel free to arrive in the inbox. I can try to help out any way I can.
That's so nice of you. Thank you. And I'll definitely have your information listed in the description box so anyone has questions for him, because I personally do not know that much about matching as an IMG, just what I learned from talking to people like you. So thank you, Bart. That was really insightful. And thank you everyone for watching. I'm sure they found this really helpful. So yeah, thanks again.